Okay, good morning.
Greetings, everyone. The Honourable Minister for Health, the Honourable Dr. Kenneth Darroux, the Ambassador of the Bolivarian Republic of Venezuela, Ambassador Hayden Pirela, the Ambassador of the Republic of Cuba, to the Ministry of Health, Helen Royer, Ambassador of Dominica to the Bolivarian Republic, Ambassador Dr. Aaron, other officials from the Ministry of Health, representatives from the Embassy of the Bolivarian Republic of Venezuela, and members of the media. A very warm and pleasant Dominican welcome to you all. I am humbled yet elated by this duty in the name of solidarity, cooperation, health, and indeed friendship. As an old quote or saying once said, your true friends are not determined by how long you have known them, but it is shown by those persons who walk into your life and say that I am here to stay, and demonstrate it. Today's activity signifies the true offer of this hand of friendship from the Bolivarian Republic of Venezuela in a form which was started many years back by the Republic of Cuba in what is known to us in English as the Miracle Eye Program, in Spanish the Mission Milagro. This mission was something that was born from the two countries, Venezuela and Cuba, in 2004, and later consolidated in 2005 in Cuba. And we have had many beneficiaries of this Miracle Eye program in the first leg, which was run by Cuban doctors. And now we are very proud once again to be signing this agreement for the Mission Milagro. Without further ado, I will allow the signing of the have some remarks from the Minister of Health, the representative of the Embassy of Venezuela, and
Okay, thank you.
Yeah, no, yeah. You could just sign this.
Yes, I want to speak. I want to speak.
Just sign this and then vamos a firmar primero.
Sí, claro.
La bandera. Y ahora se intercambian las carpetas. Se paran y se intercambian las carpetas.
Pero nunca te sea todo eso.
Gracias, señor. Gracias.
No, la cámara.
once again, this very pleasant welcome. The signatures have now been affixed to the documents. And at this moment, I would like to invite the Ambassador of the Bolivarian Republic of Venezuela, Ambassador Hayden Pirela, to grace all present with some remarks. Ambassador.
Thank you. Okay, good morning. Now I want to speak English. That I know that it's important to read the communication in English because I want the Dominican people to understand my message. Greeting to everyone. Let me wish you a happy new year. I don't know about in my country in February, we still with happy new year, excited, that's good. Today, we are to begin a great humanitarian mission, Mission Milagros. This mission has been going on in other islands in the Caribbean with great success. St. Vincent, Grenada, St. Kitts, Antigua, and now Dominica. It is important to say that the intention of the sector, our only intention is humanitarian, to help persons Venezuela is a country of its country friends. In this way, the President Maduro and his team from the Embassy of Venezuela in Dominica have achieved one of the legacy of President Chavez, to help the less fortunate people. This mission, since start 2004, has helped to restore the vision of more than 4 million of people in Latin America and the Caribbean. I want to highlight that the brother country Cuba has been an important factor for this mission. Venezuela brought thousands of Venezuelans to Cuba for this mission. Now, Venezuela brings this mission to the country. Finally, I want to express my thank you to Prime Minister Ruben Skerry and his cabinet, who with great lot had joined the Mission Milagros. Brother and sister, Venezuela will always fulfill its commitments and in fight for our internal problem. We are here and we have no other objective only to cooperate with Dominica. On behalf of the President Nicolás Maduro, thank you. I want to give the thank you to the Cuban Ambassador, Mr. Juan Carlos, the Minister of Health, my friend Dr. Kenneth Darroux, Philbert Aaron, the Ambassador of Dominica and Venezuela, and all the embassy team that is working here in Dominica. Thank you for the medium, and I hope that this mission success. That soon is going to come the doctor of Venezuela to help of Dominican people. Thank you for listening.
Thank you very much for those remarks, Ambassador Pirela. And we are very grateful that you have assured us of the friendship that is offered from Venezuela, which will continue. At this moment, I will invite the Honourable Minister for the Ministry of Health and the Environment in Dominica, the Honourable Dr. Kenneth Darroux, to share some remarks with us. Dr. Darroux.
Thank you very much, Dr. Christmas, or Master of Ceremony. Let me first recognize the presence of his ambassador of the Bolivarian Republic of Venezuela to Dominica, Ambassador Hayden Pirela, and our Permanent Secretary in the Ministry of Health, Mrs. Helen Royer, Principal Nursing Officer, Ambassador of the Republic of Cuba to Dominica, Juan Carlos Frontera. Frometa, sorry. Other invited guests and the media, thank you very much. Bienvenido. A friend in need is a friend indeed. And I think that today serves as a testimony to a truly great friendship that has stood the test of time thus far, and a friendship that means so much to so many of our citizens that it shall never, ever, ever be forgotten. And today is just one of the many ways that has borne testimony to the vision of two great friends of Dominica that we can never forget, and in honor of whom I recall two old and precious quotes. It is by chance that we met, by choice we became friends. And truly, great friends are hard to find, difficult to live, and impossible to forget. And I quote our Comandante en Jefe, Fidel Castro Ruiz, and the late Comandante Hugo Chavez. It was indeed a great day when these two presidents in July of 2004 created the marvel now known as Mission Milagro, or Miracle Eye, and 1 year later in Sandino, Pina del Rio, Cuba, where a target of totally free of charge to alleviate the problems caused by cataracts and pterygiums in the populations of Latin America and the Caribbean. Today, more than 10 years after that bold decision, we in Dominica continue to see the hand of friendship and regional integration and cooperation extended willingly and unconditionally as we strive together to promote and foster the well-being of our societies. As a development, continue to welcome you with open arms this continued gesture of mutual cooperation as an instrument for developing our communities and recognizing that health is indeed a fundamental right of every citizen. And just as these visual ailments have continued to plague our populations with the very threat of blindness, so too our many challenges, both economic and visual care, almost a fleeting illusion, but with the help of our friends, after much delay, here we are. This agreement with Venezuela was planned to be signed, allowing Dominica to continue to benefit from that initiative by Cuba in the first leg of the Miracle Eye program here in Dominica as early as September of last year. However, due to the devastation caused by Tropical Storm Erika, we were forced to delay the signing of this. And today, we again humbly say thank you to these two great nations, Cuba and Venezuela, and in particular to our fallen comrade, the late President Hugo Chavez. Without this agreement of cooperation and solidarity would fail to be a reality. Over the next several months, we intend to identify Dominican patients suffering ophthalmologic pathologies such as cataracts and pterygiums, who continue to overwhelm our own very hardworking and dedicated ophthalmology staff. And under the principles of solidarity, equality, and mutual respect, this person have been screened and fully assessed, screened and fully assessed. This screening will be done at several strategic locations across the island, allowing equal opportunity for voluntary access. Once the need for surgical intervention has been established, the full preoperative testing will be conducted, and all qualifying patients will have access to preoperative evaluation and later surgery, most of which will occur right here in Dominica, with the help of highly trained and competent teams of ophthalmologists from Venezuela. Post-op follow-ups will continue, and full documentation of all treatments free of charge, bringing great benefit to our patients, as has been the case in many of the other Caribbean territories to date. Which is why I really would like to say a big hearty thank you to my friend Ambassador Pirela and your government, and also to Ambassador Frometa, my friend from Cuba, because over the years these two countries have indeed shown this friendship that we forged over the years mean to us. We've seen this area of cooperation in aid. And if I may be allowed to speak from a more personal point of view, the houses which are being constructed right now to house the displaced citizens of my constituency have been donated by the Bolivarian Republic of Venezuela. And I really would like to say thank you, Ambassador, on behalf of my people. So in closing, again, I would just like to say another thank you. And to each and every one of you who made it here today to make this occasion, was a very short notice, but to each and every one of you who made it here today, thank you for coming. And I too wish this program much success. Thank you very much.
Special thank you again, the Honourable Dr. Darroux, for those remarks. Of course, as we mentioned, the ceremony is very brief, and Dr. Darroux just mentioned the short notice. But again, let us remind ourselves of the significance of this signing of the agreement that just took place, where again we are cementing the bonds of friendship, cooperation, which is expected to continue. And we expect that many persons here in Dominica will benefit, as a number of persons have benefited from the first leg of cooperation in this manner. At this point, we would like to invite the persons present here to pose any brief questions that they may have concerning the mission, so that the persons here could give you some further insight into what we are expected to do.
Also, is that is an expected staff get up the problem?
I want to speak Spanish. I use my translator.
Yeah, sure.
Sí, el programa solamente estaba esperando que firmáramos el acuerdo.
We were only waiting on the signing of the agreement.
En Venezuela ya están listos para venir.
In Venezuela, they are already ready to begin.
Los médicos nos llamaban todos los días, el coordinador.
The doctors and the coordinators call us every day.
Y estoy seguro que una vez que terminen los carnavales,
And I am sure that as soon as Carnival is over,
ya viene la misión para acá.
the mission will come here in Dominica.
I wanted to find out from Dr. Darroux. These services will be done here in Dominica.
Yes, sir.
Here.
Yes, sir.
How is that going to interfere with our own local services here in Dominica?
Well, as you heard, the ambassador said the aim of the mission is not to interfere or not to upset any ongoing programs. In fact, we look at this program as a way to enhance what is already going on, because we should not be naive to pretend that we do not know sometimes the cost of involving a lot of these surgical interventions by the local services, especially as it pertains to the private services. So, as you would have heard, this is a service that is free of charge. So I would think that this is an opportunity for people who over the years would have needed surgical intervention as it pertains to pterygium, that is a growth of the cornea, and cataracts, okay, to have this finally done free of charge. People who otherwise would not have been able to afford the conventional programs, the conventional ongoing programs in private practice here. So it is not designed as to interfere with any ongoing program, whether public service or private service program, but to enhance what is already existing.
How many Dominicans are expected to benefit from this program?
Well, we are going to undergo a massive screening program, and then each and anybody individual, okay, who so requires this service, okay, will have access to this service.
From what time, do you have a time frame in terms of from when to when it's going to take place?
I think a lot of this will depend on what the people who are screened and how many candidates we would have for surgery. Yeah.
Could you speak to whether
It is as Dr. Christmas and also it is an ongoing program between both Cuba, Venezuela, and Dominica. And over the years, what we have seen is that this is done on a needs basis, and we have identified the needs here. As I just told Curtis, that the number of our patients requiring this type of surgical intervention, okay, cannot afford the conventional services afforded here. So it will be looked at on a needs basis, and I'm sure as we go along, where the request will be made to our friends, okay, that they will so oblige. I'm pretty sure that they will so oblige. Yeah.
Good. Thank you very much. So once again, a special thank you for all of you for turning out and supporting this signing of the agreement. And I do wish you a very pleasant day.